Thank you, Itai. Our next speaker is Dr. Rina Rosin-Arbesfeld, and she will talk about a novel treatment for colorectal cancer, Macrolid-induced correction of premature stop codons.
Okay, thank you all for coming. I would like to thank Remote for the opportunity to provide, to introduce our work using macrolide to induce correction of premature stop codons as a treatment for colorectal cancer. So our technology, this is a new treatment for colorectal cancer by using a member of the macrolide antibiotic family, and this treatment is based on suppression of APC mutations, and I will come back to APC in a moment. This technology should lead to the establishment of a new treatment strategy also for other cancer types and other genetic diseases that result from premature stop mutations. A few basic words about colorectal cancer. This is the cancer of the large bowel. It is the third most common cancer in both men and women and represents about 13% of all cancer types. We know that in the United States alone, over 150,000 new cases are diagnosed each year and over 60,000 people will die. Another important fact for these days is that the lifetime colorectal cancer risk in the general population is about 5%, but this number really rises dramatically with age. Just in short, the genetic model for colorectal cancer development, since this is on what we based our work. So a very important thing in the development of colorectal cancer is that this type of disease develops in very well-defined stages, unlike other types of cancer. With the first thing happening, the most important step is mutation in a gene called APC. APC is actually a gatekeeper. Without mutation in this gene, they will not proceed to the development of the cancer. We know that the vast majority of colorectal cancer cases, both sporadic and hereditary, show loss of APC function. And a large proportion of these mutations are actually nonsense stop mutations. What do we know about APC in cancer? The most known or most established role of APC in cancer is as a negative regulatory of the Wnt, the oncogenic Wnt pathway. In addition, we know that APC has a very important role in maintaining cell adhesion, cell migration, and other important cellular functions such as chromosome segregation. And now we know also that APC mutations are crucial for both the development and the progression of colorectal cancer. APC mutations are found also in other cancer types such as ovarian and prostate. Looking at these APC mutations, as I mentioned before, most cases of colorectal cancer show loss of APC. A large proportion of these are nonsense, specific nucleotide change stop mutations. And our question was, how can we overcome this problem? And it is known for other genes and other diseases that if a cell can be persuaded to ignore the mutation, the resulting protein may resume its wild-type normal function. So here, I would like to demonstrate that a member of the macrolide antibiotics family can cause extensive, specifically stop codon read-through of the APC mutations. How does it work? This is just a cartoon of a translation of a wild-type protein with the ribosomes bound to the mRNA. The translation of the protein stops in the normal stop codon. When we have a premature stop codon in the genes, the ribosome will reach the stop codon disassembled there. We'll get the expression and release of a truncated protein. And when we have the macrolid that binds the large subunit of the ribosome, it changes its conformation a little bit and allows read-through and expression of a full-length protein. An important thing to say here is that normal genes are not affected by this use of antibiotics, since they lie in a context that promotes very efficient translation termination, where mutated, nonsense mutations do not lie in this context. So that it does not affect normal stop mutations. About our active drug candidate, this is a well-defined antibiotic from the macrolide family. It is currently used in veterinarian medicine. We know that it is well absorbed when it's orally administered. It is also known that it reaches the colon with no side effects, with no known side effects. And here we show that it also induces APC stop mutation read-through. We have patented this new use for the drug. Okay, our results, I'll divide them into in vitro and in vivo results, starting with in vitro. Due to lack of time, we're not showing it, but we have a large amount of reported gene experiments showing that our compound can induce APC stop mutation read-through on both DNA and protein level. We have also treated colorectal cancer cell lines with our compound and looked at some oncogenic phenotypes, such as regulation of the oncogenic Wnt signaling and other types of cell growth. We see in all cases that our compound reduces the oncogenic phenotypes of these colorectal cancer cells. Our first in vivo model is using xenograft mice, where we implant colorectal cancer cells that have a mutation in APC in these mice and monitor the development of the tumor. And we see that in most cases, there's about half, a reduction about half the growth rate and the size of the tumors in our treated mice. Here are the tumors themselves when we take them out. So they are much smaller in the treated mice. Next thing we did was just take these tumors, mash them up, and look at the protein expression in these tumors. And we see that in the treated tumors, we see the restoration, the back expression of APC that is missing in the mutated tumors. Another thing we see in these tumors are reduced levels of Wnt, of oncogenic proteins, such as COX-2, as would be expected if the Wnt signaling is downregulated. The next model we used was APC min mice. These have a mutation in the APC. This is a stop mutation that leads to a truncated protein. These mice, as humans, develop multiple adenomas throughout the intestine. Another thing that we used in our experiment is that these mice also develop anemia. And we use that fact for our next experiment shown here. These are the untreated min mice that develop anemia, so they have very low levels of hematocrit. We have treated these mice. In this case, this is females treated for 2.5 months. And we see an increase, or nearly to wild type, of the levels of anemia. This is also shown or seen in the spleen size, where mutated untreated mice have large spleens, and the treated mice have much smaller spleens. We have seen that also in the male mice. Next thing, we're just to take out the intestine and look at the tumor itself, where the untreated show large numbers and big tumors compared to the treated mice. The last experiment I would like to show is just an ongoing experiment looking at the lifespan of these mice. And we see that the treatment largely expands the lifespan of these mice. To summarize, we have provided both in vitro and in vivo evidence showing that treatment of colorectal cancer cells with a member of the Macrolid family can read through APC stop mutations, can decrease tumorigenic phenotypes, reduce number and size of tumors in xenograft and min mice, and is efficient in both prevention and treatment regimes in animal models. The potential application for such a treatment includes colorectal cancer, other cancer types, and a large number of other common genetic diseases that result from premature stop mutation in important genes. Thank you.